The aim of this video is to present the rationale for and use of different equipment for a self-management soft tissue program for an athlete. It will look at the more commonly used pieces of equipment and demonstrate how to use each one on different parts of the body. Considerations for the practical implementation of this type of program will also be outlined. Here are some terms to understand for this video. Self-management can be defined as the taking of responsibility of one's own behaviour or well-being. With an athletic population, it is most commonly known to refer to different techniques used to promote or aid recovery from training or competition, particularly in relation to mobility and flexibility of the soft tissues in the body. Soft tissue refers to muscles, nerves, blood, connective tissues such as fat, tendons, ligaments, fascia, skin, and other supporting tissue matrix. Fascia is a connective tissue that can attach, stabilize, enclose, and separate muscles and other internal organs. Its aim is to reduce friction of muscular force and resist tension, and has been described as a body-wide tensional network which connects all muscles, ligaments, and tendons. Trigger points are hyper-excitable areas of muscle tissue, sometimes created through overuse of a muscle. Tissue compliance refers to the ease in which a tissue is deformed or its volume changed as a result of pressure being applied. Exercise causes various disruptive responses to the body's tissues, resulting in delayed onset of muscle soreness, discomfort and inflammation which can reduce range of motion and flexibility. These responses, whilst necessary for adaptation, cause discomfort, inflammation and general feelings of stiffness. Fascia can become restricted due to injury, inactivity, prolonged postures and/or inflammation, and can reduce flexibility and range of motion. This affects the athlete's ability to express strength, endurance and coordination, disrupts their postural awareness and movement accuracy, and can increase the perception of stiffness and pain. Extensibility and elasticity of muscles and other soft tissues is necessary, as this influences the speed of muscle contraction and relaxation, which strongly influences force production and reduction and movement efficiency. It is important to note that compromised tissue compliance and muscle damage can occur in the absence of soreness, so intervention strategies must be maintained despite the absence of symptoms. Tissue compliance is therefore intimately linked to both injury prevention and optimizing performance. Massage is the most obvious intervention to address tissue compliance. It has been found to decrease perception of fatigue, improve range of movement, improve recovery and power, and decrease DOMS. It is proposed to increase blood flow, which increases oxygen and nutrient delivery, reducing muscle tension and also improving perception of well-being and stiffness. This in turn may increase confidence and enhance performance. However, many athletes have limited or no access to a qualified massage or soft tissue therapist. Therefore, self-management soft tissue techniques can provide a viable and portable alternative. Self-massage can provide benefits to athletes seeking a recovery modality that is relatively affordable, easy to perform and time efficient, while also enhancing soft tissue recovery. While research regarding self-massage techniques is a growing area, there is emerging literature that presents some advantageous results. Studies using the stick have shown improvements in sit and reach scores when used on the hamstrings, improved movement economy of a lunge motion after rolling the anterior thigh, and hamstring range of motion was increased in a study addressing the fascial network of the sole of the feet, which emphasized how the fascial network is connected within the body. Studies using a foam roller have shown a reduction in DOMS and minimized decrements in broad jump, 30-meter sprint and 70% 1RM squat test to failure after exercise. There has also been improved hamstring range of motion after just 10 seconds of rolling without any decrease in force production from the hamstrings during a leg curl exercise, and foam rolling the fascial network around the lower back region has been shown to improve fascial mobility without increasing lumbar flexion. Some of the physiological theories proposed suggest that these techniques open up blood vessels and increase blood flow, making the area more flexible. Friction is also created during the rolling movement, and this causes the fascia to increase in temperature and possibly change to a more fluid-like state. This change in state allows for the breaking apart of fibrous adhesions between the different layers of the fascia and restores the soft tissue extensibility. Self-massage benefits are also beginning to emerge in special populations with increased muscle tone or spasm, such as stroke patients, which further supports it is a safe and effective tool to address tissue compliance. This provides evidence that reducing the tone and improving tissue compliance can be useful for the able-bodied or disabled athlete or a person recovering from a stroke. The advantages mentioned support anecdotal claims that soft tissue self-management can provide a beneficial response. Massage techniques will vary in pressure, location, speed and position in which they are administered in relation to the muscle fibre direction. The variety of tools available to the athlete for self-management represents different materials, sizes, shapes and firmness. This suggests that just like massage, the tools and the fashion with which it is utilised will also influence the change occurring within the muscle. Furthermore, due to the various shapes, some self-management tools may be more appropriate in certain environments. Therefore, we encourage individualisation in your soft tissue self-management. Trigger point therapy can be administered by continual compression or from stroking. Stroking is a gentle motion that promotes circulation and involves intermittent contact with the area, which is beneficial for athletes with a lower pain tolerance. By applying continual focus pressure, a trigger point can be reduced, allowing greater function and flexibility within the tissues. When the problematic area is found, the small focus of pressure is applied to the tissue either continuously or for a varying amount of time, of anything up to 2 minutes. Greater frequency is advocated in the literature, meaning the application of shorter, more frequent sessions. This creates consistency while increasing the mind-body interaction, and the athlete becomes more self-aware of regions that are tight and require treatment. As a result, their self-management processes will become more efficient and precise and better able to communicate their physical status to coaches and support staff. A limiting factor of self-management is the amount of pressure one can exert. However, evidence suggests that anything more than a 7 out of 10 pain level is unnecessary and less efficient. Therefore, self-management has a distinct advantage, that it is more likely the person will self-regulate the pressure and relax. Before progressing to the instructional section of the video, it is important to be aware of a few key points. These are principles that are consistent throughout each technique. It is vital that you are in a comfortable and well-supported body position and posture to be able to apply the right pressure and movement that you require without causing discomfort or extra effort to hold a position. You might be recovering one area but stressing another. This seems like an obvious point, but it is important that you remain relaxed and refrain from tensing too much. Some muscle activity, proposed to be 1 out of 10, is inevitable and actually beneficial due to the heat being produced, which improves mobility. An easy way to facilitate relaxation and prevent tensing is to focus on your breathing. Note the relaxed state of the athletes when using the various tools presented throughout the video. It is key that you develop an awareness of the pressure you are applying and can then adapt it to suit and achieve the outcome you want depending on your level of soreness and discomfort tolerance. Choose the most appropriate tool or piece of equipment for the body area being massaged. Trial the different pieces of equipment and techniques to work out which ones respond to the best and therefore help you understand the role of soft tissue self-management better. In this section, we'll introduce the various types of self-management equipment and show you how to use them on different muscle areas of the body. It is also possible to construct your own self-management tools at minimal cost. Shown here are a variety of foam rollers of different lengths, composition, density, and surfaces which will give a slightly different feel when using them. Larger foam rollers are mostly used at home or a training facility, while the shorter rollers are easy to pack when travelling. A higher density roller allows a higher pressure contact. The pressure applied on the tissue can be modified through the combination of body weight load, foam roller density, and speed or range of rolling pattern. There are differing surfaces, and by combining dimpled or flat grid areas with small teeth, allowing different size areas and gradients of pressure within neighbouring tissues to facilitate blood flow and tissue compliance. The teeth also allow more specific and focused pressure to be applied. With a softer foam surface and hard centre tubing, this balances the contact pressure ratio. Plastic PVC pipe is an example of a cheap homemade version. This roller would apply a significantly higher amount of pressure on tissues as it has no soft interface of foam to manage that pressure. This can be useful with particularly stubborn tissue or for people with large muscle mass who require greater levels of pressure. To counter this, a towel or piece of foam could be wrapped around the pipe to create a cushioning barrier. Sitting on the floor, place the foam roller behind you in line with your spine and lower yourself onto the roller. Lift your hips off the ground to support your lower back. Extend your arms to the ceiling and then lower them out to the side and back up again, keeping your trunk braced. This helps with opening up the chest, upper back and thoracic area. Lie on the roller with it perpendicular or at right angle to your spine so your body curves over the roller to assist mobilizing your spinal segments. You can lie here breathing calmly or raise your arms over your head and back again. Keep your trunk braced to reduce any extra lifting or elevation of the spine off the roller. Move the foam roller by 2 to 3 vertebrae and repeat. You may need to raise your hips if you are stiff and require extra support. Placing the foam roller as seen in the previous video, raise your hips off the ground, then using your legs, drive the movement by extending and flexing them. Slowly roll from the center of your back to the top of your shoulder blades and then back. Your arms can be straight out to the side for support, behind your neck or across your shoulders. You can roll the length of your spine or focus on smaller sections that feel stiff or sore. Lie on your side and place the foam roller under and perpendicular to your bottom leg. Bend your top leg in front of you with your foot on the floor level with your bottom knee to support your body weight and help drive the movement. Place your bottom arm in line with your body and your top arm in front with your hand or forearms on the ground. Using your upper body and top leg to move, start at the top of your leg and roll down towards the knee and then back up. For increased pressure, stack your legs on top of each other. This requires more upper body strength to perform the movement. Sit on the foam roller, using your arms behind you for support and pushing your chest out. To start with, have the leg of the side you wish to roll straight out in front and the other leg bent so as to drive the movement. Pushing with your bent leg, slowly roll from the top of the glute where it meets your lower back down towards the top of the hamstrings and then back again. You can complete this on both glutes by having both legs straight out in front and using your upper body to push and pull for movement. You can increase the pressure by putting the targeted leg up on the bent leg with your foot on the opposite knee. This places the glute under a stretch and some tension, which then challenges the tissue compliance of these muscles. While seated on the ground, elevate one leg and place the foam roller perpendicular and underneath directly onto the back of the thigh. Bend your other leg up with your foot on the floor. Again, this will provide the movement for rolling. Put your hands behind you on the floor, then using your arms and bent legs, slowly move the roller up and down from the glutes towards the knee, then back up. You can complete this with your feet pointed straight up, foot pointed out or inwards, and this will affect differing areas of the hamstrings group. If you are new to foam rolling, you can start with both legs on the roller, advance to one leg on the roller, and finally the legs stacked to increase the pressure placed upon the hamstring. This video shows a grid roller being used on the hamstrings. As mentioned, the grid roller allows a mixture of a flat area as well as the individual teeth to provide a more specific point of pressure on the tissue, as can be seen with the close-up video here. For the calf, you have the same body position and action as for the hamstrings, except that the foam roller is under your calf area. Use your arms and bent leg to create the rolling motion from the back of your ankle up to the back of your knee. You can pinpoint different aspects of the calf musculature by rolling with your feet pointed straight up for the central region, foot pointed out for the lateral aspect, or your foot pointing inwards for the medial aspect. If you are new to foam rolling, you can start with both legs on the roller, advance to one leg on the roller, and finally the legs stacked to increase the pressure placed upon the calf. You can also apply some trigger point therapy by not rolling your calf, but by keeping it in one place and rotating it from side to side as you see here. Lying on your stomach, supporting your body weight on your forearms, place the foam roller perpendicular to your leg at the top part of your anterior thigh. Your other leg lies just off to the side with your toes pressing into the ground, as this will assist with the rolling movement. Using your arms and other foot, slowly roll yourself towards the knee and then back up towards your hip. You can complete this with your toes pointed straight down or slightly facing either direction to increase the focus on that area. If you're new to foam rolling, you can start with both legs on the roller, advance to one leg on the roller, and finally the legs stacked to increase the pressure placed upon the quadriceps. Lying on your stomach, slightly on one side with the top hip and knee slightly flexed, body weight supported on one hand and one forearm. Place the foam roller perpendicular to your adductors of your top leg at the inside part of your thigh. Generally, it is easier to use a small length of roller for this area. Using your arms, slowly roll yourself towards the knee and then back up to your groin. Lying directly on your side, place the foam roller perpendicular to the body and in the armpit area. Slightly turn your upper body so that it faces upwards. Bend your top leg and place the foot on the floor behind your opposite knee. In small motions, slowly roll up and down over the foam roller from the armpit down 10 centimeters and then back up again. Lying on your stomach, slightly turn your upper body away from the floor with your bottom arm above your head, top knee slightly flexed and top hand supporting your weight. Place the foam roller under your chest and slowly roll up and down, starting from the armpit down to the middle of the ribs and back up again. Another piece of equipment used in self-management are different types of sports balls. Examples seen here include a golf ball, lacrosse ball, softball, and a homemade version of a peanut, which is two balls taped together. The main difference between them is the size, and this has an effect on the area being treated by the athlete. As they are all very hard, they are more commonly used to treat specific issues or trigger points. This applies more concentrated pressure so that more layers of the tissue can be treated within a self-management session. As demonstrated here, position yourself in a sitting position with both hands weight-bearing behind you. To begin with, place both feet on the ground so you can continually adjust the body position and pressure. Then use the hands and feet as fixed points and slowly rock back and forth on the area of tightness. To increase the pressure, subtly lean the body over to one side. The videos here show a softball and a lacrosse ball being used, and the close-ups show a difference in pressure that can be applied due to the different sizes of each ball. To apply more pressure to the gluteal muscles in a lengthened position, cross one leg over onto the opposite knee. If this creates too much pressure, then uncross the legs. In the same position as for foam rolling the hamstrings, place the ball under the thigh and roll or trigger point the muscle. Rotate the leg to target the medial or lateral hamstrings. Adjust your body weight to change the pressure. Another good option is to sit on a chair or box. Straighten your leg and place the ball behind one of your legs. Using the arms and other leg on the floor, slowly roll over the ball from the hip towards the knee. Once a tight region is identified, straighten and bend the leg to further concentrate the pressure under changing tension and length. This can be completed with your toes straight up or out to either side. Adopt the same seated position as you would to foam roll your calf and place the ball under your calf. When you have found an appropriate pressure, slowly move the calf on top of the ball in an up and down or side to side motion. To increase the pressure, leave the buttocks a small distance off the ground. As these two videos show, the ball can be placed on the inside, outside, middle, lower or upper calf and can be moved up and down the leg with large strokes, or it can be rolled perpendicular to the leg. Again, you can see the difference in surface and pressure area between a larger softball and a smaller lacrosse ball. In a standing or seated position, place a lacrosse ball or golf ball under the sole of the foot. Shift the weight of your body to support leg and position the ball on the arch or sole of the foot. To increase the pressure, begin to accept more load onto the ball. Slowly roll the ball in either a forward and backward motion from the heel to toes or side to side of the foot. Place the ball against the wall and standing about one step away from the wall, lean onto the ball with your upper back or shoulder area. Cross your arm to the other shoulder and slowly roll lengthwise using the upper body and torso to direct the movement. You can adjust the ball to multiple positions based off what tension is felt or needed. Place the ball against the wall and then place your chest against it. Start higher up, close to the clavicle, and work outwards towards the armpit. Rolling can be done lengthways or up and down. Use your legs to move your body against the ball. The Peanut offers the advantage of being very portable and a more practical self-management tool, particularly when travelling. It is also extremely simple to make as it just requires 2 balls and tape. Several styles of peanuts using different materials can be designed to vary the firmness and aggressiveness of the pressure. This can range from tennis balls to hockey balls. A thero-wedge is a similar piece of equipment for use along the spine. Place the peanut on the ground and lie back so that a ball is in contact with the muscles on either side of the spine. The peanut is placed at the desired level of mobilization along the upper spine. Cross your arms over the chest or have them by your side. Then slowly raise your shoulders off the ground for a count of up to 3 seconds and then back down to the ground. As you crunch up, you can rotate to each side, then back down again, thereby targeting range of motion in flexion, extension, and rotation. 2 to 3 sets of 15 reps has been recommended, although it is important to perform as many reps as the athlete feels necessary to have the desired effect. If this position is uncomfortable or painful, standing upright and placing the peanut against a wall provides a viable alternative. The stick, also known as the roller massager, offers a convenient tool for travelling. It can be used in a seated or lying position and differs from the foam roller in that the pressure is applied mainly by the upper extremity as opposed to manipulating the body position to apply the desired force. It could also be useful for athletes who sit on the bench during a match for a period of time, especially if space is limited. Therefore, this could be useful for team sports involving rolling subs. Due to the finer control that the stick offers, it makes manipulating speed easier. Development is a well-known massage technique which requires using the hands in a rapid alternating fashion. It is used to provide an invigorating stimulus during the pre-event period to excite the muscles. The stick can provide a similar stimulus for the athlete who doesn't have the luxury of a manual therapist. Seated, starting from the crease of your hip pushing down, slowly roll the stick towards your knee. You can roll directly on top of the thigh or to either side of it based on where you find tension. You can complete the full length of the muscle or complete in small sections. Sit on the side edge of the seat, tuck your foot slightly behind you so that the TFL or outside part of your thigh is pointing down to the ground. Place the stick near the hip and then pushing into the muscle, proceed to roll down the outside of the knee and back up again. You can complete the full length of the muscle or small sections of it. Sit on the front edge of the seat, start from the bottom of the glute, pulling the stick upwards. Slowly roll the stick towards your knee. You can roll directly beneath the thigh or to either side based on where you find tension. You can complete the full length of the muscle or again in small sections. Sit on the front edge of a seat and allow your leg to fall outwards slightly, so your adductors or inside of your thigh turns toward the ceiling. Place the stick on your adductors near your hip and pushing into the thigh muscles, roll toward your knee and back up again. Again, you can do the full length or in small sections. Seated, you can use the stick to roll from the back of the knee down towards the heel. You can roll on the inside, in the middle, or on the outside of the calf muscle, based on where you find tension in the calf. You can complete the full length of the muscle or in small sections. As you have seen throughout all these videos, the key points listed on the screen are central to maximise the benefits of a soft tissue self-management program and are applicable to all the techniques shown and many more. As the main aim of this self-management program is to promote recovery, it is critical that in the execution of these techniques that you are able to relax in order to enhance the natural healing processes of the body and ultimately improve your ability to train and compete injury-free at your highest ability level. When implementing a soft tissue self-management program to be done at home, travelling, or at the sessions the S&C coach may not be present, we have to consider the what, when, how, and where aspects of the program. Starting with the when, foam rolling has shown to have benefits before and during the warm-up or during a training session. In the warm-up, foam rolling should not take longer than 10 minutes, so pick 3 to 5 key areas to foam roll that you may know may be tight or that will help with the day's training. The athlete should foam roll each area for 1 to 2 minutes, as this has been shown to not have an effect on the force generating capabilities of the muscle tissue, unlike static stretching. It will increase range of motion, which can allow the athlete to improve technique and biomechanics and could potentially lower the chances of injury. This is an important point and why foam rolling in the warm-up can enhance the upcoming training session. During a training session, you can include foam rolling as necessary to aid in increasing the range of motion in exercise, such as rolling the glutes for a back squat. Foam rolling during a session should last up to 1 minute and can be done during the rest intervals between sets. There are different times of the training week or year when it would be beneficial to increase time or sessions of self-massage to aid recovery, particularly away from the training environment. For example, when training load increases such as pre-season or at training camps, or decreases such as an unloading week or taper when the priority of training has shifted from loading to recovery. With all the different tools available to use for soft tissue massage, the athlete will have to pick the appropriate tool for the appropriate time or muscle group. Larger area foam rollers are a good introductory tool for athletes new to self-massage, as it will not create as much discomfort initially. For smaller muscle areas or specific sites, a small ball would be best. A larger foam roller is good for muscles with a larger surface area. Using the hardest density that the athlete can tolerate will ensure maximal results for increased range of motion. Smaller items like the peanut and stick are very useful when travelling, but a shorter foam roller may be required. Pressure and movement, be it static or over a range, and speed are the variables to change how you self-massage for differing effects. These are the same with any piece of equipment, so you need to find the right combination of how to do it with the equipment you choose. Big advantage of self-massage is that it can be done almost anywhere and anytime, so it really is an easy addition to an athlete's overall training program. By knowing the desired outcome, the right place to do it can be straightforward to discover. Implementation of a self-management program has multiple benefits as discussed. However, it can create difficulties in ensuring that it is done properly. Communication between coach and athlete is very important. Coaches now have access to multiple platforms like email and Skype to directly communicate with the athlete no matter where they are in the world. We can also utilize videos on YouTube or setting up of a Dropbox account to share videos to demonstrate technique. It is recommended that a coach video an athlete completing the specific self-management exercise and then place that into a common format so that it can always be referenced back to. You can utilize YouTube videos, but quality control can be difficult and you cannot be sure if the information shared in the video is true. A program like Dropbox, however, can be beneficial in allowing the athlete to video themselves doing it at home or local gym so the coach can give feedback. There are many web or mobile-based apps available which can also be used within an individual or team environment that coaches and athletes can consider using. Some athletes may prefer a paper version with pictures and the key points for each drill, which could be stuck up on a wall at home or put in a training diary. This could be emailed and saved for use when offline as well. All this helps an athlete to develop their overall self-management skills, not just for soft tissue work, but for managing their sporting performances, for school life and social life as well. The key to any self-management program is understanding why it is being undertaken, how to perform it correctly, and performing it consistently. We trust this video has provided you with the information and education to safely and effectively begin implementing your soft tissue self-management program.